चालू कर देंगे।
Okay, so we will start with the session today. So still few seconds are there, and this session is by the topics which will be useful for the students to clear the upcoming next exam which is coming, and this will be useful for the students of first year MBBS. So all the notes and all important facts which is important to know about the knee joint will be discussed. Okay, so today in this session we will discuss knee joints, and the referral code which you can use mine is the Dr. Lisa YT, myself Dr. Monalisa. And before starting the session, let everyone join, and we can I just want to tell you that I have got an experience of teaching anatomy for the past 7 years. The plus subscription description, so you can avail the opportunity to see the daily live sessions and live classes. Okay, also live tests and quizzes are there, so you can avail the opportunity to become a part of live tests and quizzes. It's a structured course. If you go for the plus subscription, you will get a structured course for clearing your any upcoming examination, whichever you want to clear, either it is INICT, FMG exam, or the NEET PG examination, or in the coming time that is the next examination. Unlimited access will be given to you for seeing all the video lectures and all the recorded one, also all the PDF will be provided to you, and you can avail the opportunity to be a part of live sessions. Okay, so again you can use my referral code Dr. Lisa YT for 10% discount. Now I also want to give you the details of iconic subscription, which is the merging of the Prep Ladder and Unacademy platform. Okay, so this is again very useful for you because you can avail the opportunity to become the part of both Prep Ladder and Unacademy. Live classes are there, batch courses are there, live tests and quizzes are there, and video lectures and the QBack 2 rapid revision courses are also provided, so you can avail the opportunity of all these courses. And I would also like to give you the information which the Unacademy has started a daily T20 for the NEET PG 2022 students, those who want to clear the examination of NEET PG 2022. So they can every day at 9 p.m. So for 2022, the students can avail the opportunity of free live series at 9 p.m. every day, and the student who wants to appear for NEET PG 2021 daily, there is free live test series at 8 p.m. So you can avail the opportunity to become the part of these test series. This is absolutely free. Now free live sessions of my own class. So already in the month of November I have taken so many live sessions. You can just click on Dr. Monalisa and anatomy. You can search on the Unacademy platform free live classes of Monalisa, and you will get all the free live session. I would also like to tell you about my upcoming free live sessions. Like today is 28th, so it's 28th and it's 29th and 30th November. So every day I am coming up with the free live sessions, okay, free live sessions. So you can avail the opportunity to become the part of this. Well, like today it's the free live sessions of mine is coming at 2 p.m. today. So and so you just be a part of this, and you can join my group, that is Monalisa Anatomy Telegram group, Monalisa Anatomy. You can also join the group, this is the Monalisa Anatomy group at the rate of Telegram group. So you can join this group and avail the opportunity of my all free live classes sessions, and also you can join the Unacademy platform group where the upcoming sessions and free live sessions of all the educators are provided. So at the end I will also give you the Telegram group link of the Unacademy platform. Okay, so before that let's start with the topic of today's session, that is the knee joint. So before starting the session I would like to give the learning objective of this session. So the objective of this session is that it would be the examination will be it would be useful for you to clear the first year examination It will be useful for you to clear the first year prof examination. It would be also useful for clearing the MCQs which will be catered for the NEET PG 2021. It will be also useful for you to clear the FMG examination and the next examination. And what we are going to study is the ligaments of the knee joint. We are going to study the ligaments of the knee joint. We are going to study also, we are going to study the nerve supply and that of the arterial supply, and so in between, so anyone can ask questions from me. Okay, so you can ask questions from me. So starting with the sessions now, starting with the type of joint. The first thing which is very important is to know the type of joint the knee joint is. Actually, knee joint is the most complex joint in our body. It is a compound and the complex joint. So first thing about the knee joint is that the first important point which you have to know about knee joint is that it is a compound joint and it is a complex joint. So I would like to just explain you both the term. It is important that you should know about both the term. What do you mean by the compound joint and what do you mean by the complex joint? So it is important that you should understand both these points. So starting with the first, that is the compound joint. Okay. So compound joint means the joint which is formed by the articulation of more than one bone, means more than two bones. Generally a joint is formed between two bones. Okay, so when there is an articulation of more than two bones, for example here the articulation is with the patella bone, the femur is there and the tibia is there. So lower end of the femur, upper end of tibia and that of the patella together forms a joint together, that is called as the knee joint. So yes, more than two bones are taking part in formation of these joints. So this is an example of compound joint. Now the second point is why it is a complex joint. So what happens in the case of knee joint, there is a joint cavity and inside the joint cavity we have got semilunar cartilages. What we have got? We have got semilunar cartilages. Okay, so semilunar cartilage means meniscus, that means meniscus, that is medial and lateral meniscus. So we have got medial and lateral meniscus. Okay, so medial and lateral meniscus is there and this will divide the cavity of joint, this will divide the knee joint cavity into two compartments. One is above and the one is below. Okay, so the above compartment is called as menisco-femoral compartment in which flexion and extension takes place, and the lower compartment is called as the meniscotibial compartment. Okay, I will also show you the semilunar cartilage and again explain these points. So and different movements occur in these two compartments. So upper compartment, the movement which is occurring is flexion and extension, and in the lower compartment the movement which is occurring is medial rotation and lateral rotation. So because of this, knee joint is the complex joint of our body. Now coming to type of joint, so let me write details about the type of joint. So when we talk about type of joint, so about knee joint, so knee joint as a whole is modified hinge joint. As a whole, knee joint is modified hinge joint. As a whole, knee joint is modified hinge joint. Okay, as a whole it's a modified hinge joint, but if we want to know the type of joint according to the articulation, so according to the articulation, if you want to know, so the articulation between femur and that of patella, that is called as femoropatellar joint. You can say patella bone, that is called as femoropatellar joint. So this is an example of which articulation? This is an example of saddle articulation, saddle type of synovial joint or saddle articulation. And the articulation between femur condyles, between the condyles of femur plus the condyles of, between the femur condyles and the condyles of tibia. Okay, if we consider the articulation between these two bones, that is femur and the tibial condyles, this articulation is called as condylar joint. Okay, so with this we just understand that there is articulations, that is saddle and condylar, and as a whole knee joint is considered to be modified hinge joint. So yes, I would also like to show you the diagram in which you can better understand the articulation. So here what you can see, the lower end of the femur. So let me just use a highlighter. Okay, So here you can see this is the lower end of the femur, which is articulating with, so this is articulating with the upper end of the tibia. So these are articular surface, as you can see here, and also the patella bone will articulate with that of the femur. Okay, so these are all articular surface, and together it will form the knee joint. So this articulation is shown here, and the articulation is perfectly between, femoral condyles, that is medial and lateral femoral condyles, along with the tibial condyles, again medial and lateral tibial condyles, and along with articulation with the patella bone. So these all articulate together to form the articular surface of the knee joint. So yes, we have done with this. Now moving to the stability of the knee joint. So actually knee joint is getting stability from the surrounding muscles, tendons, and also the surrounding ligaments. So very important is the muscles which is surrounding the knee joint. So muscles surrounding the knee joint is performing or providing, muscles surrounding the knee joint is giving stability to the knee joint. Other than that, also we have got the ligaments. Okay, so important ligaments which is providing the support. So yes, so any doubt you can ask me, students are there, so I will you can ask me the doubts. Okay, yes. Okay, just seeing the live charts. Okay, so yes, you can type your doubts. So muscles surrounding the knee joint is providing the stability. Other than that, the important ligaments, for example, there is two type of cruciate ligament. There is anterior and there is posterior cruciate ligament. So anterior and posterior cruciate ligament is very important for providing antero-posterior stability to the knee joint. Also, the important stability is given by medial and lateral collateral ligament, which is also called as tibial and fibular collateral ligament of the knee joint. Iliotibial tract, which is providing stability to the flexed or partially flexed knee. So these are basically important points for the providing stability to the knee joint. Okay, these are important structures which is providing stability to knee joint. Now other than that, let's see the capsular ligament of knee joint. So the capsule so many ligaments are there. So before starting the ligament individually, I would like to tell you the names of the ligament. Important ligaments which is providing stability, as we have seen, two important ligaments are very important for stability, the cruciate ligaments and the collateral ligaments. Other than that, we have got fibrous capsule, we have got semilunar cartilages, we have got oblique popliteal ligament, we have got arcuate ligament, we have got coronary ligament. So many ligaments are there, and these all ligaments all together provide stability to the knee joint. So the first ligament which is very important is the fibrous capsule. As you can see, the fibrous capsule is attached to the margins of the joint, so articular margins of the knee joint. Okay, approximately 0.5 mm to 1 mm around the articular margin, and certain important factors are very important, that where there is lying a gap in the knee, in the fibrous capsule of the knee joint. So I would like to tell you about that point also. Actually, on anterior aspect, there lies suprapatellar bursa and ligamentum patellae. So these two structures is providing a gap for the fibrous capsule, and also fibrous capsule is considering the origin of popliteus muscle. Also the tendon of popliteus muscle passes. So these are important points in relation to the capsular ligament of knee joint. Other than that, what you can appreciate that here the synovial layer is lying just inside, the layering of synovial membrane is lying. So what you can appreciate here, so this layer which you are seeing is the synovial membrane. Okay, so this is the synovial membrane, and outside we have got, on the outer aspect we have got, this is the fibrous capsule. Okay, so what you can say, the fibrous capsule inside is having a synovial membrane covering, and together it is called as articular capsule. So one more diagram I would like to show you. So just see here the important point is about the joint cavity which is having synovial fluid, and as I told you, articular capsule is given the term together the fibrous capsule and synovial membrane. So what you can understand, that fibrous capsule is there, inside it is having a synovial membrane which seizes towards the articular cartilage. So what you can see, it is covering the inner aspect of fibrous capsule as shown in the diagram. So you can see it is covering the inner aspect, it lies on the inner aspect of fibrous capsule, but it is not lying over the articular cartilage, as you can see in the diagram. So together these two structure, that is fibrous capsule plus the synovial membrane, as shown in the diagram also, is considered to be articular capsule. It is the articular capsule of knee joint. Now coming to the capsular ligament of knee joint, certain important points which we should not leave. The important points about the capsular ligament of knee joint is following. So write down, capsular ligament of knee joint attaches to the articular margin of knee joint. So it is attaching to the articular margin of knee joint, having certain gaps. So it is having certain gaps, and these gaps are for suprapatellar, bursa and patellar ligament. Patellar means ligamentum patellar. So ligamentum patelli ligament. Another gap is for ligamentum patelli ligaments. Okay. So suprapatellar bursa and gap for the ligamentum patelli. So this is lying anteriorly and superiorly, and this is lying anteriorly and inferiorly. So important point about the capsular ligament of knee joint is also that it includes the one of the important point, and often asked as an MCQ question, is that what muscle tendon has got intracapsular origin. So it includes the origin of which muscle? Popliteus muscle. So popliteus muscle is having intracapsular origin of it is lying intracapsular. It is lying intracapsular. The origin and the tendons are intracapsular. Okay, so this is important point, often asked as an MCQ session also. Now other than that, let's move on to the next ligament which I want to show you. Actually this is the ligamentum patellae. To be more specific, so you can see here the ligamentum patellae as shown in the diagram. Okay, this ligament which you are seeing is the ligamentum patellae. Now this ligamentum patellae, as you can see, is actually the tendon. It is insertion of which tendon? Quadriceps. So upper aspect you can see quadriceps tendon, and this together quadriceps femoris muscle is formed by the four muscles, as you know, vastus medialis, lateralis, intermedius and rectus femoris. Together their insertion is forming ligamentum patellae. So it's actually ligamentum patellae is formed as by the, it is formed by ligamentum patellae is actually formed by the tendons of, or it is the formed by tendons of quadriceps femoris muscle. Quadriceps femoris muscle attaches to the tibial tuberosity, smooth part. So it is attaches lower down to tibial tuberosity, smooth part. Now coming to the next ligaments, that is collateral ligament. So the next ligament which we will see is the collateral ligament. So we have got one collateral ligament on the medial aspect and another collateral ligament onto the lateral aspect. We have got two collateral ligaments, as we have seen. We are seeing this in the diagram. I will firstly explain it and then give you the notes about this. So see here, we can appreciate this is the lateral collateral ligament. Okay, and when you will see the medial collateral ligament, it has got two parts. Okay, so as you can see, the medial collateral ligament has got two parts. So let me explain each of it. The lateral and that of medial collateral ligament. So actually medial collateral ligament has got two parts. One is the superficial and other is the deep. Medial collateral ligament has got both superficial and deep part, and the lateral collateral ligament is having only the one part, okay, it's having only one part. Now when you will see the superficial part of the medial collateral ligaments, so when we are just see here, so you can see this is the superficial part of medial collateral ligament, which is getting attached onto the medial posteromedial aspect of the upper part of the tibia medially, and it will cover the medial genicular nerves and vessels. Okay, it will also cover the semimembranosus muscle, and this medial collateral ligament superficial part itself is covered by the tendons of sartorius muscle, gracilis and semitendinosus. Now when you will see this part, which as you can see is going inside, so this is the medial collateral ligament, meniscus is there. Okay, this structure is the meniscus, that is medial semilunar cartilage. So medial collateral ligament is attached, or medial meniscus is merging with medial collateral ligament along with the fibrous capsule of the knee joint. Now let's see the discussion for the lateral collateral ligament. Lateral collateral ligament is attaching above to the lateral epicondyle. So one more important point about both medial and lateral collateral ligament is that they are attached to the respective condyles, epicondyles of the, they are attached to the respective epicondyles of that of the femur. So lateral collateral ligament is attached to lateral epicondyle, medial collateral ligament is attached to medial epicondyle, and lateral collateral ligament from this medial epicondyle get attached into the head of fibula, as you can see in the diagram, and it covers the lateral genicular nerves and vessels, lateral genicular nerves and vessels. Also, it is important for us to know that these collateral ligaments are degenerated part of which structure. So let me firstly write down the details of this. So firstly, I would like to explain you medial collateral ligament. Medial collateral ligament. Medial collateral ligament is also called as tibial collateral ligament. The other name of medial collateral ligament is tibial collateral ligament. This is medial and this is tibial collateral ligament. Now, coming to the further discussion. So, superior attachment, if we talk about superior attachment of medial collateral ligament, so superiorly it is attached to medial epicondyle of femur. If we talk about lower attachment or inferior attachment, if we talk about lower or inferior attachment, it is having two parts. One is superficial part and other is the deep part. One is superficial part and other is the deep part. So it is important for us to know the attachment of each part. So starting with the superficial part. Superficial part of the tibial collateral ligament. Superficial part of the tibial collateral ligament is attached to medial upper aspect of medial upper part of tibia bone, and it covers, so it is covering which structure? It is covering medial genicular nerves and vessel. It is covering medial genicular nerves and vessels. It also covers semimembranosus muscle. It also covers semimembranosus muscle and is overlapped by the medial or the tibial collateral ligament is overlapped by itself is overlapped by the tendons of three muscles, the tendons of following muscle, that is sartorius, the semitendinosus, I am writing in short form ST, and that of gracilis. Okay, so these three muscle tendon will cover the medial genicular nerves and vessel, and will cover the tibial collateral ligament, which is covering the medial genicular nerves and vessels. Now the other important point about medial collateral ligament is that it is the degenerated part of which structure. So it is important for your MCQ session that you should be aware that medial genicular, that medial or tibial collateral ligament is actually degenerated part of which structure. So it is the degenerated part of, it is degenerated part of ischial head of adductor magnus muscle. Which muscle? Adductor magnus muscle. Now coming to the next ligament, that is the lateral collateral ligament. So now moving to the lateral collateral ligament. Lateral collateral ligament, as we know, is also called as fibular collateral ligament. It is called as fibular collateral ligament. And moving on to its attachments and all. So superiorly it is attached to, when we talk about superior attachment, superiorly it is attached to lateral epicondyle of femur, and inferiorly, when we talk about inferior attachment of the lateral collateral ligament, so inferiorly the lateral collateral ligament is attached to head of fibula, and it is covering which structure? It is covering the lateral genicular nerves and vessel. It is covering which structure? It is covering lateral genicular nerves and vessels. It is covering lateral genicular nerves and vessels, and it itself is overlapped by biceps femoris. The other important point is that this lateral collateral ligament is not attached to that of merging with lateral meniscus. The basic point which I have told you about medial meniscus is getting attached to that of medial collateral ligament. So that point I have told you in the explanation. Other important thing is that it is degenerated part of which tendon? So lateral collateral ligament is degenerated part of, peroneus longus muscle. So this is the details of lateral and medial collateral ligament. Now moving on to the cruciate ligament. Okay, so how many cruciate ligaments we have got? We have got 2 cruciate ligaments. So let me just show you in this diagram. So here you can see this is the one cruciate ligament which is shown. This is the anterior cruciate ligament, and this is the part of the posterior cruciate ligament. So this is the posterior cruciate ligament. So we are seeing from the posterior aspect, so we can just see both the cruciate. So this is the part of posterior cruciate ligament. So we have got 2 cruciate ligaments. This part is the anterior one, and this part is the posterior cruciate ligament. Okay, posterior and anterior cruciate ligament. These 2 cruciate ligaments are required for the antero-posterior stability of the knee joint. And the reason it is called as anterior and posterior, that depends on the fact that whether it is lying onto the anterior on the posterior part of the intercondylar area. So that would decide whether it is called as anterior or posterior cruciate ligament. So write down. So starting with both, so we have got 2 cruciate ligament is important for cruciate ligaments maintains antero-posterior stability of knee joint. So it is maintaining antero-posterior stability of knee joint, and it is termed as anterior and posterior according to its attachment on tibia intercondylar area. So according to its attachment on tibia intercondylar area, it is termed as anterior or posterior. If it is attached anterior part of intercondylar area of tibia, it is called as anterior cruciate ligament, and if it is attached onto the posterior part, it is called as posterior cruciate ligaments. Now other important point about cruciate ligament is that both anterior cruciate ligament and that of posterior cruciate ligaments are intracapsular and extrasynovial structures. They are intracapsular and extrasynovial structure, and these points are again important for your MCQ session. Now moving on to the explanation of each of the cruciate ligaments. So first I would like to explain you about anterior cruciate ligament, the details of anterior cruciate ligament. So write down anterior cruciate ligament. So anterior cruciate ligament is attached on anterior part of intercondylar area. It is attached on anterior part of intercondylar area of tibia, and from here it passes upwards, backwards and laterally, to be attached on, it passes upward, backwards and laterally to be attached on, upward, backwards and laterally to be attached on medial surface of lateral condyle of femur, okay. And anterior cruciate ligament is stout during extension of knee joint. Anterior cruciate ligament is stout during extension of knee joint. Now moving on to the next ligament. What is the second part of the cruciate ligament? We have got posterior cruciate ligament. So when we talk about posterior cruciate ligament, it is attached onto the posterior aspect of, intercondylar area of tibia, and from here it is directed, what is the direction? It is directed upwards, medially and forward. So upward, forward and medially, it is directed upward, forward and medially to be attached on which structure? So it is attached on medial condyle of femur. So it is attached onto the lateral aspect of medial condyle of femur, Now the other important aspect is that the posterior cruciate ligament is stout during. So when it is stout during which movement of the knee joint? Posterior cruciate ligament is stout during the flexion movement of the knee joint, So yes, these are the details of the cruciate ligament, both anterior and posterior cruciate ligament. Now moving on to the next ligaments. So thereafter we will just see about the details of semilunar cartilage. Okay, we will just discuss the details of semilunar cartilage. So it is important, actually semilunar cartilage is very important in context of knee joint. The other name of semilunar cartilage is that it is also called as meniscus. So how many meniscus we have got? We have got lateral and we have got medial meniscus. Menisci or meniscus, and these are required for the division of the cavity of knee joint into two parts. So the presence of the meniscus, which will better help in the articulation of the femoral condyles and tibial condyles, and it will also divide the joint cavity of knee joint into two compartments. The part of the knee joint compartment which is lying above the meniscus is called as meniscofemoral compartment, and the part of this compartment which is lying below this meniscus is called meniscotibial compartment. Two different types of movement occurs in this compartment. In the upper meniscofemoral compartment, the movement which takes place is flexion and extension of knee joint, and in the lower meniscotibial compartment, the movement which is taking place is the medial and lateral rotation. So let me just write firstly the details. I want to show you the difference which lies in the gross difference between the two semilunar cartilage, that is medial and lateral meniscus. So here what you can appreciate, this is the medial meniscus, and the shape of medial meniscus is semilunar. As you can see, it is having anterior horn and posterior horn, And if we will see the whole shape of this meniscus, it is semilunar, half moon. But if you compare the shape of lateral meniscus, it is more or less circular only. It is more or less circular. So this is the difference. It is also having anterior horn and posterior horn. Now one more things which can be appreciated in this diagram. So firstly I will explain you the things and then I will show you the literature part. So one more thing which can be appreciated here in this diagram. So let me use again a highlighter. So see here, this is the posterior horn, and from posterior horn you are seeing two ligaments are extending, or two extensions are there from the posterior horn of lateral. This is the one, and the one is lying posteriorly. So this is the other which is lying posterior. This is the other extensions. Can you see here? So one I have marked with yellow color and the other extension I have marked with the green color, and in between it is having this ligament. So what is this I am marking with blue color? This ligament is actually posterior cruciate ligament. So in between there is posterior cruciate ligament. Okay, so if you want I can just use red color. So for this posterior ligament, so see here, two ligaments are there. Okay, so just see this diagram and you will understand the content. Okay, so what you can see, this in relation to posterior cruciate ligament, which I have, let me use a laser. So see here, this is the one extension from posterior horn, this green color, which is forming, which is running anterior to that of posterior cruciate ligament. This extension is called as meniscofemoral, anterior meniscofemoral ligament. Actually the extension from the lateral meniscus is going to attach medial condyle of femur. So when it is diverging upward, you can see this extension which is shown in the green color is meniscofemoral ligament. Okay, which is anterior one, passing anterior to posterior cruciate ligament in relation, and this red color highlighted extension from posterior horn is also going to attach on the medial condyle of femur, but it is going posterior to in relation to posterior cruciate ligament, and this ligament is called as posterior meniscofemoral ligament. Posterior meniscofemoral ligament is also called as ligament of Würzburg, and anterior meniscofemoral ligament is called as ligament of Humphrey. So let me write the details. So starting with the details of semilunar cartilages. So we have got two semilunar cartilages. Okay, we have got two semilunar cartilages. The basic difference between two semilunar cartilages. So one side write down medial meniscus and other side write down lateral meniscus. So medial meniscus is, if you talk about medial meniscus is semilunar in shape, and lateral meniscus is C-shaped, or you can say circular. It is it is rounded or circular. So generally O-shaped is a better term because semilunar or C-shape will be used for medial meniscus. Okay, O-shape or circular, not a complete O, but just near about to O or circular. Medial meniscus is attached to, as we have seen, it is attached to medial collateral ligament. And when we talk about lateral meniscus, it is attached to, lateral meniscus is attached to popliteus muscle tendon. It is not attached popliteus muscle. Actually, it is not attached to popliteus muscle tendon. It's not attached to that of any collateral ligament, or it is not adherent to fibrous capsule. So this is the key point, which means that lateral meniscus is more mobile as compared to that of medial meniscus. So this is the reason medial meniscus is more prone to injury as compared to lateral meniscus, which is less prone to injury. Yes, now coming on with the other point, that semilunar cartilage will divide the joint cavity into two compartments. Will divide the joint cavity into how many compartments? Into two compartments. Now it is important for us to know what movement occurs in the upper and the lower compartment. So the upper compartment is called as menisco. It is called as menisco femoral compartment, and the movement which is taking place in the meniscofemoral compartment is flexion and extension of knee joint, flexion and extension of knee joint. Now coming to the lower compartment is called as meniscotibial compartment, and the movement which is taking place in the meniscotibial compartment is medial and lateral rotation, So this is the reason why knee joint is the most complex joint, and also it is the two movements occurring in the two compartments. Now other than that, I would like to give you further details about lateral meniscus. So posterior horn of lateral meniscus, menisci is extended extending to be attached on medial condyle of femur, So when the extension is anterior to posterior cruciate ligament, this ligament is called as ligament of Humphrey. How you are going to remember? H comes before W, and it is also called as anterior meniscofemoral ligament. And when this extension is, when this extension is posterior to posterior cruciate ligament. So if it is posterior, so other point is that if the extension is posterior to posterior cruciate ligament, it is termed as posterior meniscofemoral ligament, posterior meniscofemoral ligament, and posterior meniscofemoral ligament is also called as ligament of Würzburg, Okay, now we have done with this. Now coming to some of the secondary ligaments. So primary ligament we have already covered, and the secondary ligaments. So I just will give the important points of this. So starting with the ligament here, which I am going to show you, is the tendon. Can you see here? This is the tendon of semimembranosus muscle. This is semimembranosus muscle, and it will form an extension here, as you can see from the posterior aspect of the knee joint. This extension which you are seeing is the oblique popliteal ligament. So it is actually the extension or the flattened membranous part arising from semimembranosus muscle. Also here you can appreciate this fiber. These are arcuate popliteal ligament, and this is curving here to be attached onto the femur and tibia. So write down the details of arcuate and oblique popliteal ligament. So oblique popliteal ligament, again important for MCQ. Oblique popliteal ligament is flattened tendon of, it is flattened tendon of which muscle? Semimembranosus muscle. And what are the structures by which it is pierced? So it is again asked that structures, the again important point is asked, structures piercing oblique popliteal ligament. So the structures piercing oblique popliteal ligament are following. It is pierced by following structures. It is pierced by middle genicular nerve. It is pierced by middle genicular vessels, and the posterior division of, also by posterior division of obturator nerve, These are the structures piercing oblique and arcuate popliteal ligament. And if we talk about arcuate popliteal ligament, it is extending from head of fibula to tibia, intercondylar area, posterior part of the intercondylar area, posterior part of intercondylar area to the lateral condyle of and also to the lateral condyle of femur. Now moving to the other accessory ligaments, so we have got transverse ligament. So here can you see this ligament which is shown? Actually transverse ligament, when I talk about the transverse ligament, so you can see this is the transverse ligament. It is connecting the anterior end of the two meniscus. Transverse ligament is connecting the anterior end of the two meniscus. So write down, transverse ligament is connecting transverse ligament is connecting anterior ends of the two meniscus. We have also got coronary ligament. So coronary ligament is the another accessory ligament. So again I would like to firstly mark it and then show you. Can you see here, this is the coronary ligament, this extensions on both the side there will be, this is the coronary ligament. Actually coronary ligament is the peripheral part of fibrous capsule. So write down the details. Coronary ligament is peripheral part of, actually it is the peripheral part of fibrous capsule, and this peripheral part of fibrous capsule is also providing accessory stability along with providing the attachments to the menisci, to the tibia. So yes, thereafter now moving to the bursas around the knee joint. So we have got important bursas which we can see here. The important bursas are prepatellar bursa, suprapatellar bursa, pex anserine bursa and infrapatellar bursa. So I would like to give you the information here, and then we will move on with the movements and relations, nerve supply and all. So what you can appreciate here, this suprapatellar bursa is lying superiorly, okay, in the lower end of the femur. So it is lying between the skin and the upper part of the here you can see the just anterior to the lower end of the femur. So this is suprapatellar bursa. The prepatellar bursa, when you see the prepatellar bursa, it is lying onto the skin and that of the upper part of the tibial tuberosity. Infrapatellar bursa is of two types, one is deep, another is subcutaneous. So infrapatellar bursa is lying between the skin and that of the lower part of tibial tuberosity. We have got another bursa that is called as pex anserine. Actually pex anserine bursa is important as it is forming a separation between the three tendons of the muscles, that is sartorius, the gracilis and semitendinosus, from that of the tibial collateral ligament. So it is separating these three muscles from the tibial collateral ligament. Now, what is the role of these bursas? These bursas are required for lubrication and free mobility of knee joint. So yes, now moving on to the relations around the knee joint. So see this diagram. So in this diagram the important relations have been shown. So here we can see the ligamentum patella, the transverse ligament. These all structures are lying on the anterior relations. When we move on to the lateral aspect, so we have got posteromedially. If we move on posteromedially, we have got following muscles: gracilis is there, semimembranosus is there, we have got semitendinosus, okay, medial head of gastrocnemius. And when we move on to the posterolateral aspect, we have got plantaris, biceps femoris, common peroneal nerve, lateral head of gastrocnemius. And only posterior aspect means in relation to popliteal region, the structures lying is nerve, artery and vein. What are these? These structures are, the nerve is tibial nerve and these vessels are popliteal vessels. These vessels are popliteal vessels which are related onto the posterior aspect, okay. Also on the medial and lateral aspect, in relation to knee joint, there will be medial and lateral patellar retinaculum, okay. There will be extensions like this, and these are the important structures showing the ligaments and all. Also we can see on lateral and medial aspect we have got the lateral aspect tibial collateral ligament, and on medial aspect we have got tibial collateral ligament. So these are the important relations of knee joint. After that, let's see the nerve supply and the arterial supply. So the important nerves which is providing innervation to knee joints are, one is the femoral nerve, femoral nerve, also the common peroneal nerve and tibial nerve which is lying in close relation to the knee joint, and also obturator nerve. also obturator nerve. So these are obturator nerve. These are the nerves which is providing innervation to the knee joint. Now to be more specific, which branch of femoral nerve is specifically giving innervation to knee joint? The answer will be nerve to vastus medialis. Okay, this is via nerve to vastus medialis. This is a branch from femoral nerve. And to be more specific, which branch of obturator nerve is forming innervation for this knee joint? The answer will be posterior division of obturator nerve. Posterior division of obturator nerve. Now moving on to the arterial supply. Now knee joint is a area where there is rich anastomosis between the important vessels here, and they form an anastomotic network along the knee joint. Okay. So here I will give you the name of the arteries, and so important arteries are, first thing is that genicular branches. So we know, we have already seen that the popliteal artery is lying in close relation with the knee joint. So its genicular branches will form. So there is 5 genicular branches. There is medial superior genicular, there is medial inferior genicular, lateral inferior and lateral superior geniculars, which is forming a rich anastomosis here. And also we have got middle genicular. Also the other branches are descending genicular artery, which is a branch of femoral artery. We have got a branch of lateral circumflex femoral artery, that is descending branch, and we have got the circumflex femolar, which is a branch from the posterior tibial artery, and we have got recurrent branches from anterior tibial artery. So write down arterial supply, just write down the name of the arteries. So name of the arteries are following: 5 genicular branches of popliteal artery. 5 genicular branches of popliteal artery. So I would not like to give you the exact name. So why? Because I have already enumerated. So I think it is not difficult for you. Just the name of genicular arteries. So 5 genicular, 1 is middle and 2 are medial and lateral, superior, inferior. So 5 genicular branches of popliteal arteries, and we have got descending genicular artery. So descending genicular artery, and you already know the descending genicular artery is a branch of femoral artery. Also descending genicular branch of lateral circumflex femoral artery. Lateral circumflex femoral artery. Okay, descending genicular branch of lateral circumflex femoral artery. And we have got recurrent branches from anterior tibial artery, and we have got lateral circumflex fibular branches from posterior tibial artery. So all these arteries are providing blood supply to the knee joint. Now moving to the movements. So important movements are actually knee joint. Important movement is flexion, extension, medial rotation and lateral rotation. Other than that, also important is the locking and unlocking of knee joint. So see this diagram. So locking and unlocking of the knee joint. So this is locked, means all the ligaments are tensed and taut, and this is the ligaments are flexed in unlocked position. So this is unlocking, and this is the locking of knee joint. Now what is locking and unlocking? So locking of knee joint is done by which muscle? Quadriceps femoris muscle. And actually locking of knee joint means that there is the medial rotation of femur on a fixed tibia on the ground during the terminal phase of extension. So it takes place in the terminal phase of extension. And when we talk about unlocking of the knee, which is performed by the popliteus muscle. So unlocking of the knee is lateral rotation of femur. So it is the lateral rotation of femur onto the fixed tibia on the foot is fixed onto the ground during initiation of the flexion movement of the knee joint, during initial phase of the flexion movement of the knee joint. This is the unlocking of the knee. Now other than that, let's write the important movements and the muscles performing this movement. So flexion movement. Flexion movement is performed by following muscles: semimembranosus, semitendinosus, also by popliteus muscle, also by sartorius muscle, also by gastrocnemius and plantaris. gastrocnemius, plantaris, these are accessory muscles, also by biceps femoris, flexion. Now moving on to the extension movement of the knee joint. Extension movement of the knee joint. Extension is done by quadriceps femoris muscle. Extension is done by quadriceps femoris muscle, tensor fascia lata. Now coming to medial rotation and lateral rotation. So medial rotation, MR for medial rotation. Medial rotation is done by following muscle: SM for semimembranosus, ST for semitendinosus, and also by popliteus muscle, sartorius and gracilis. Sartorius and gracilis. Lateral rotation is done by biceps femoris muscle, also by gluteus maximus muscle, and TFL, that is tensor fascia lata. Tensor fascia lata. So these are the muscles which is performing the movements around the knee joint. Now after that, moving to the other important clinical aspect related to the topic, that is osteoarthritis. Now knee joint is commonly involved in cases of osteoarthritis. What you can appreciate, the joint space is reduced. So joint space is reduced and the very painful movement. So the patient will have painful movements. So restriction of movement is there because of the pain, and the knee joint is commonly involved in case of osteoarthritic condition. There is joint space reduced because of synovial fluid has been degenerated. The other important thing related with unhappy triad, which when a fast track injury in athletic persons, generally rugby or football player, so it occurs, the three important ligaments are torn or injured, and the healing process is so much delayed, and also the integrity of these ligaments to 100% is not regenerated. So this is called as unhappy triad of knee joint. The ligaments which is injured is medial collateral ligament. So it is the three ligaments are injured as shown in the diagram also, and the ligament, as we know, the medial meniscus and medial collateral ligament are lying close to each other. So these two ligaments are injured, medial or tibial collateral ligament along with medial meniscus along with the anterior cruciate ligament. So these three ligaments when torn together is called as O'Donoghue or terrible triad or unhappy triad of the knee joint. Now coming to the other, housemaid knee. Now in case of housemaid knee, can you see here the condition is showing the bursitis. What do you mean by bursitis? Inflammation of the bursa, and the bursa which is involved in housemaid knee is prepatellar bursa. So prepatellar bursa is inflamed, and to be more specific, subcutaneous prepatellar bursa. It is the subcutaneous prepatellar bursa which is inflamed. As you can see in the diagram, it is inflamed, and this is commonly seen in maids, so it is called as housemaid knee. The other is clergyman's knee, which is seen in priest, and they have got the habit of kneel down and they pray for long hours. And here the bursitis, which is bursa which is involved is subcutaneous infrapatellar bursitis. Subcutaneous infrapatellar bursitis. It is a condition of subcutaneous infrapatellar bursitis. Now also sometimes there is involvement of the bursa which is lying in relation to semimembranosus, semitendinosus and sartorius. Actually that is pex anserine bursitis. So here the bursa which is involved is pex anserine. Pex anserine bursa is inflamed, and to be knowing the location, so it is the bursa. So it is the bursa which is separating. It's the bursa which is separating the tendons of sartorius muscle, semitendinosus and gracilis muscle from tibial collateral ligament. So when this ligament is inflamed, when these bursa is inflamed, the condition is called as the pex anserine bursitis. So these are the important key features which is very important to be known in case of the knee joint. And before ending the session, I would like to give again the brief of Unacademy platform. So So this is the Unacademy platform. You can just avail the opportunity with just downloading the app, and you can avail the opportunity to view live sessions of all the 19 subjects taken by the educators across India. And NEET PG is, you can search for NEET PG Gold and select the live classes of your educator which you want to view and follow them. And there is live doubt clearance, and also poll is there in which you can just know your position among the other competitors of your. A good healthy competition can be done. And those who wish to join the Unacademy platform can use my referral code Dr. Lisa -YT for 10% discount. And this is t.me, that is Unacademy NEET PG. So this is Unacademy NEET PG. Okay, so this is the link for Unacademy NEET PG. This is the link for the Unacademy platform. So Telegram group link. Do join this platform because all the free live sessions links is provided here. Also, you can find me on to the Unacademy Plus platform by searching me in the NEET PG courses. Also, so many courses are going on, comprehensive courses which is going on for the students who will avail the opportunity in 2022. Telegram group link is Monalisa Anatomy. So my Telegram group link is Monalisa Anatomy. So yes, you can join this group because here I just update all my upcoming sessions on YouTube, also on the special live free sessions on the Unacademy platform. So all that free live classes you can avail, and also the link is provided. Also the PDF is provided. Also the previous sessions, if you have missed, I will give the link of the classes, and you can ask your anatomy related doubt there. You can avail the opportunity of seeing all live classes. Follow me on YouTube. You can follow me or can join my group of Facebook, that is Dr. Monalisa Anatomy. You can use my referral code Dr. Lisa -YT for 10% discount. And yes, this is the Telegram. So Unacademy NEET PG. Unacademy NEET PG is the Telegram group of Unacademy NEET PG. So do join that group and avail the opportunity of all upcoming sessions. Thank you so much. Again, we will meet up with the new topic. This topic was very important as the knee joint, which will be helpful for you to clear the MCQs in relation to NEET PG examination, in relation to INI-CT examination, in relation to FMG, in relation to the next examination, and also will be very useful for the first year MBBS students, and all the notes have been provided. Thank you so much. All the best. Keep reading. Thank you.